What's going on, world? Welcome, welcome, welcome. Y'all already know what today is. First of all, you see the gray. Got some gray up in there. You know what I'm saying? Got some gray up in here. Got some gray. This isn't fuzz, people. This isn't fuzz. This is gray hair. Gray hair. Hey, welcome. You guys already know what we're doing. We are doing NCLEX questions today here on this Wednesday. I appreciate everybody being here. You guys already know the deal. I need 100 people and I need 1,000 likes. 100 people and 1,000 likes. If I don't have either one, we are not going anywhere. Trust and believe me. Y'all know I'm not playing no games with y'all. All right. But of course, if you guys are new here, welcome. My name is Kevin. I go by the boot nurse. I've been a nurse for 3.5 years. I've worked ICU, OR, and PACU. Hey, somebody just told me that they passed the NCLEX. Is it Hakalo? I'm sorry if I butchered your name. But ma'am, congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. Congratulations. If there's a piece of advice that you could give to everybody, ma'am, what would it be? And once again, congratulations to you. What type of nurse are you, a RN or LPN? Okay. Like I said, ladies and gentlemen, RN, 3.5 years, ICU, OR, PACU, as well as I was in the Navy for 16 years. I was a hospital corpsman, was a surgical tech, then I became a master instructor, and I was an instructor for all the way until I got out. But of course, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? So studying for the NCLEX is a whole different battle from, so yes, 100%, Sydney, 100%. BB, I appreciate your support. Thank you. Hey, make sure you guys smash that like button. Make sure you guys share. All right. Make sure you guys follow. That is the trifecta. All right. I need 100. I got 100 people up in here. Right. So I should have already 1,000 likes. We ain't going nowhere until I get 1,000 likes. Hey, get carpal tunnel from me right now. Make it happen. Thank you so much. Past the PN NCLEX and currently in the ADN program. Shout out to you. Hey, I just want to let y'all know that with the ADN or with an ADN RN program versus a PN program, it's all about scope of practice. You learn the same exact content. It's all about that same exact content. Okay. BB says, I'm going into my third term. Shout out to you, BB. Hey, so what? I'm guessing it's 3 out of 5. So you're about halfway there. Any tips on how to study adult health? It's understanding patho, understanding the disease processes and how they affect the body, and then prioritizing based off of what's going on, prioritizing like what's going to kill the patient first of what you need to attack first, if that makes sense. 3 out of 4, the LPN. Hey, you're almost there. 75% of the way. 75% of the way. Hey, we're almost there to we're almost there to 1,000 likes, y'all. We're almost there. It says, my advice would be to be confident. I doubted myself so much and felt silly afterwards. That's okay, because that's all part of the process, okay? But you guys already know what the deal is. We got 1,000 people up in here. So, we got 200 people in here and 1,000 likes, but here we go. Ladies and gentlemen, question number 1. A 16-year-old client with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in the patient's care? Is it perform a postural drainage and chest physiotherapy every 4 hours? Allow the patient to decide whether she needs aerosolized medication, place the patient in a private room to decrease the risk for further infection, or plan activities to allow at least 8 hours of uninterrupted sleep. What are we thinking? Hey, welcome. If you guys are new here, we're doing NCLEX questions. Management of care. This is what this one looks like to me, right? So make sure you guys like, share, follow, smash that like button, share, and follow. Also, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Is it Liliana? Thank you for the follow. If you're here, I think you're here. It's great to be here. I'm glad to have you here. Hey, if you're new here, I want to know who you are and where you're from and where you're at in your nursing journey. All right, here we go. In 3, 2, and oops, just kidding. There we go. And the answer is A. It's to perform postural drainage and chest physiotherapy every 4 hours. Airway clearance techniques are critical for patients with cystic fibrosis and should take priority over other activities. All right, that is part of management of care. Remember, when you guys are going through your questions, you guys need to read your rationales, because your rationales help you retain the information that you have learned. Okay, so shout out to everybody that got this right. And if you didn't get it right, that's okay. Circle back and get that content. All right. Hey, remember this is a review. It's a refresher. You should already know a lot of these things, but if you don't, then find out where your deficit's at. All right. I'm an RN for the past 20 years, and I'm currently director of nursing at a prison. Oh, Bethy, you be fighting folks? Got hands? Could you work at a prison? I see you. Question number 2. A patient with a pulmonary embolism is receiving anticoagulation with IV heparin. What instruction would you give the nursing assistant who will be helping the patient with activities of daily living? Select all that apply. Is it use a lift sheet when moving and positioning the patient in bed? Use an electric razor when shaving the patient each day. Use a soft bristle toothbrush or tooth sponge for oral care. Use a rectal thermometer to obtain a more accurate body temperature. Be sure the patient's footwear has a firm sole when the patient ambulates. What are we thinking? Select all that apply. All right. Hey, by the way, if I don't have 10,000 likes by the time I get to question 10, I'm all of a sudden not going to know how to talk. I'm going to pull a Monique. For the original Queens of Comedy. Just saying. Run me that check. Oh, my goodness. Hey, welcome. We're doing NCLEX questions. These are both for RNs and LPNs, by the way. RNs and LPNs. Lizzie, how are you? All right. I'll give you guys 10 more seconds. It says run, don't walk to the hallways of F. Heparin, no razor. Okay. All right, y'all. We got some smarty folks up in here. What's up, Key? How are you? All right, y'all. Here we go. Here's our answer. Lizzie, thank you for the follow. And 3, 2, it says a little late. Is this for LPN? No, this is for LPNs and RNs. All right, but the answer is A, B, C, and E. All of the other instructions are appropriate. All the other instructions are appropriate of care of a patient receiving anticoagulants. Risk for bleeding may arise in any condition that disturbs the closed circuit integrity of the circulatory system. Bleeding is the primary complication of anticoagulant therapy and is a risk of all anticoagulants, even when maintained within the usual therapeutic range. All right. Once again, that's about management of care type of question. All right. So A, B, C, and E. All right. So educate. All right. Also, bleeding factors. We don't use straight razors because of the bleeding risk. All right. So electric razor is okay to use, and so is the soft bristle. Right. Not because they're non-abrasive. All right. The difference between LPN and LVN is nothing. It's just the name or the letters based off of location. It literally is the same exact thing. Patrick says, hell yeah, I'm ready for the NCLEX. Shout out to you, brother. Shout out to you. Question number 3. A patient with acute respiratory distress syndrome is receiving oxygen by a non-rebreather mask, but ABG measurements still show poor oxygenation. As a nurse responsible for this patient, you would anticipate a physician order for what action? All right, so they're having an acute respiratory issue and they are not improving on a non-rebreather. So what would I do? All right, perform endotracheal intubation and initiate mechanical ventilation. Immediately begin continuous positive airway pressure via the patient's nose and mouth. Administer furosemide, 100 milligrams IV push stat, or call a code for respiratory arrest. What are we thinking? Shout out to all 340 or 360 of y'all. We are doing NCLEX questions. These are both for RNs and LPNs, LVNs, all right, nurses. Okay, make sure you guys like, make sure you guys share, make sure you guys follow. We're on the road to 10,000 likes. I got these questions off nurseslabs.com. They are free sets of questions. All right. You guys go over there and check them out for yourself. By the way, if you're in nursing school right now and you have not shared this to anybody, you're wrong. And I'm going to need for you to fix yourself. Mostly it's because stop trying to hoard me. You know what I'm saying? There's plenty of Kevin to go around. You know what I'm saying? That's why this is TikTok. All right. Stop being stingy and share. But the answer is A, perform endotracheal intubation and initiate mechanical ventilation, a non-rebreather mask. Can deliver nearly 100% of oxygen when the patient's oxygenation status does not improve adequately in response to the delivery of oxygen at this high concentration. Refractory hypoxemia is present. Usually at this stage, the patient is working very hard to breathe and may go into respiratory arrest unless healthcare providers intervene by providing intubation and mechanical ventilation to decrease the patient's work of breathing. All right. Once again, that's a management of care. Management of care. These are management of care type of questions, ladies and gentlemen. Okay. And I know somebody's going to say, oh, as a nurse, I can't intubate. No one said anything about you intubating. All right. it says, what is the physician's order? The physician's order is going to be to intubate. Because remember, the non-rebreather mask can give me 100% of O2. I can't give you 150, right? So now I need to give you an advanced airway to make sure it's getting into the lungs. All right? So pay attention to that. Remember, RTFQ, all right? Who can tell me what RTFQ means? Somebody let me, like, if you're a frequent flyer, let us know down in the chat what RTFQ means. Question number 4. The nurse is caring for a patient with chronic obstructive pulmonary disease. Which intervention for airway management should you delegate to the nursing assistant? Read the effing question. Yeah, Sabo, you know what's up. You know the deal. All right, so nursing assistant or the UAP. Egg, you must be new here. Y'all let Egg know what RTFQ means, all right? Is it assisting the patient to sit up on the side of the bed, instructing the patient to cough effectively, teaching the patient to use incentive spirometer or auscultation of breath sounds every 4 hours. Remember, nursing assistant, they can say nursing assistant, they can say unassistive or unlicensed assistive personnel, right? CNA or what is it? The certified nursing assistant, they can use all of them. All right. Same broad scope of practice for them. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys like, share, and follow. We're on the road to 10,000 likes, or I'm going to have a problem. Like Monique, run me that money. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is A, assisting the patient to sitting up on the side of the bed. Assisting patients with positioning and activities of daily living is within the educational preparation and scope of practice of a nursing assistant. Some examples of tasks and aspects of care that can be delegated legally to unprofessional, unlicensed assistive nursing personnel, provided they are competent in these areas under direct supervision of the nurse, including assistance with transfers, range of motion, feeding, ambulation, and other tasks such as making beds and assisting with bowel and bladder functions. Hey, management of care. Nurses are the only ones that can eat, who can eat, educate. Oh, I would like, first of all, everybody can eat out here. I want y'all to eat, even if it ain't at my table. But yes, nurses do not delegate what they eat. All right. So shout out to everybody that got that question right. Here we go. Question number 5. Lizzie, I appreciate you. All right, here we go. Question number 5. A patient with sleep apnea has a nursing diagnosis of sleep deprivation related to disrupted sleep cycle. Which action should you delegate to the nursing assistant? Once again, this is supervision, delegation, assignment type of question, which falls under management of care. All right. So discuss weight loss strategies such as diet and exercise with the patient. Teach the patient how to set up the BiPAP machine before sleeping. Remind the patient to sleep on his side instead of his back, or administer, modafinil to promote daytime wakefulness. What are we thinking? Shout out to y'all to get me to 10,000 likes. Hey, who's to say I can't get to 20? Hey, make it happen. Make it happen right now. G, I see you. Stop playing games. Get out of my chat playing games, Miss G. I done told you. All right. Hey, if you guys are new here, welcome. We're doing RN and LVN or LPN NCLEX questions. I got them off nurseslabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. What's up, Travy? What's up, man? Got the whole gang over here. All right. But the answer is C, remind the patient to sleep on his side instead of his back. The nursing assistant can remind patients about actions that have already been taught by the nurse and are a part of the patient's plan of care. The right person must be assigned to the right task and jobs under the right circumstances. The nurse who assigns the tasks and jobs must then communicate with and direct the person doing the task or job. The nurse supervises the person and determines whether or not the job was done in the correct, appropriate, safe, and that is part of management of care, because that is delegation, assignment, supervision. You as the RN or whoever's going to be the RN supervises, make sure that they do what they are supposed to do. Okay. Shout out to you, Miss G, with the friendship necklace. I appreciate you. All right. Hey, make sure you guys understand that. This has been a nurse for hey, was it Karen? I appreciate this. I'm glad that you like it. Hey, if y'all like it, go over there and get you some test questions or some testing tips to help you conquer the NCLEX. Hey, it's a free download, 42 pages of deliciousness that this dude with this fanny pack made. I'm silly, y'all. Anyways, hey, go over there and check that out. That's over there linked is at thebootnurse.com/test. And you can also find it linked in my bio on the link tree. You guys can find it over there. So thebootnurse.com/test, go get you a free download. All right, here we go. Question number 6. Shorty says, I graduate nursing May of 2024. Shout out to you, Shorty. Question number 6. After a change of shift, you are caring for the following patients. Which patient should you see first? Once again, this is a delegation. Who's going to die if I don't see them first? Who's going to die? Who's going to die? Is it a 60-year-old patient on a ventilator for whom a sterile sputum specimen must be sent to the lab? A 55-year-old with COPD and a pulse oximetry reading from the previous shift of 90% saturation? A 70-year-old with pneumonia who needs to be started on IV antibiotics? Or is it a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator? What are we thinking? Hey, so a little bit about me, if you guys are new here. My name is Kevin. I've been a nurse for 3.5 years. I was in the Navy for 16 years. My entire adult career has been in medicine. I was a surge tech, hospital corpsman in the Navy, and then I became a master instructor in the Navy, and that's all I've been doing since. So I've been teaching for a long time. So I appreciate you guys for being here. No institution wants to hire me, so guess what that means? I got to bring my talents to motherfucking TikTok. But I love y'all for being here, all right? So we got a bunch of people saying C and D. Well, let's see what the answer is in 3, 2, and the answer is D, a 50-year-old with asthma who complains of shortness of breath after using a bronchodilator. The patient with asthma did not achieve relief from shortness of breath after using the bronchodilator and is at risk for respiratory complications. This patient needs are urgent. In particular, a patient who is chronically on short-acting beta-2 agonists risks not achieving the same relief from their medication as they once did. The phenomena is called receptor downregulation. It happens because portions of the receptors targeted end up being inactivated by the body due to overuse. Yes, we're talking about ABCs, but think about it. I have a person that's 50 that has asthma, which is a chronic issue, and they're complaining of shortness of breath. Usually people that do have an exacerbation of asthma do have a shortness of breath, but it's supposed to be relieved by a bronchodilator. So the expected outcome was not given. So when the expected outcome is not given, it now garners my full attention. Okay, does that make sense? Hopefully that makes sense. If that makes sense, smash that like button and stop playing games with me. You know what I'm saying? I'm being real aggressive today here on this Wednesday, mostly because I had a monster and I'm amped. So let's get it. I appreciate y'all. If you got it wrong, make sure you practice these. Management of care is the largest section on the NCLEX. All right. The largest section on the NCLEX, RNs, 18 to 21%. For LPNs, it's coordinated care and it's the same numbers. So remember that. All right, here we go. Question number 7. After the respiratory therapist, shout out to all my RTs, performs suctioning on a patient who is intubated, the nursing assistant measures vital signs for the patient. Which vital sign value should the nursing assistant report to the registered nurse immediately? All right. Is it A, heart rate of 98, respiratory rate of 24, a blood pressure of 168/90, or a tympanic temperature of 101.4? What are we thinking? Hey, if you guys are new here, here's something that you guys don't know. If you're new here, I failed my NCLEX 3 times. Yeah, I said it. I failed it 3 times. And let me tell you how much I care about what any of y'all about to say about that. I don't care. Because not one of you have ever walked a day in my shoes and know what I've gone through. Just like no one has ever walked a day in your shoes and knows what you go through. So if you are going to take the NCLEX, get out of your own way. What's up, Aaron? How are you? Get out of your own way. Stop playing games with me and stop playing games with yourself. All right. This exam is all about safety. It's all about safety. So you need to understand the safety aspects of it. Okay. But get out of your own way. Get out of your own way. You know who's never going to ask you how many times you took the NCLEX? Your job and your patient. You know what I'm saying? And this test will not determine the type of nurse that you will be. The only thing that does that is you and your actions going forth after you get that license. All right. Stop playing games. I failed PN 15 times. Cool. So you mean to tell me you're going to go take it for a 16th time? I hope so. Anyways, but the answer is D, tympanic temperature of 101.4. That's a fever. Now, infections are always a threat to the patient receiving mechanical ventilation. The endotracheal tube bypasses the body's normal air filtering mechanisms and provides a direct access route for bacteria or viruses to the lower part of the respiratory system. Now, think about it. We call this VAP, ventilated associated pneumonia, because you can get, when you get pneumonia or bacteria or a virus inside of those lungs, the way that you're going to know, I can't tell you that I have a fever, but my temperature will tell you that I have a fever. Does that make sense? This is why it's important that we read our rationales. This is why it's important, right? You have to read your rationales. You need content, you need Q&A, you need rationale. Stop playing games with me. 20,000 likes. Hey, I need 30,000 likes right now. Hey, let's go. Get carpal tunnel for me. All right, here we go. Question number 8. An experienced LPN under the supervision of the team leader RN, all right, is providing nursing care for a patient with a respiratory problem. Which actions are appropriate to the scope of practice of the experienced LPN? Select all that apply. Now, you're an experienced LPN. LPNs, here we are. Here you go. All right, can you auscultate breath sounds? Can you administer medications via a metered dosed inhaler? Can you complete an in-depth admission assessment? What's the key word in that one? Can you initiate the care plan? What's in that? Can you evaluate the patient's technique for using MDIs? What's the key word in there? You see what I'm saying? Look for those key words and understand what you can and can't do. And then you also need to know what you can and cannot accept. All right. And remember, I would rather you get it wrong here and guess so you know going forward so you don't get it wrong on your exam. All right. And here we go. I'm gonna give you guys 10 more seconds. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us today here on this Wednesday? All right, y'all, here we go. Here's our answer in 3, 2, and the answer is A and B. So shout out to everybody that picked A and B. Appropriate decisions relating to the successful assignment of care are accurately based on the needs of the patient, the skills of the staff's position description or job description, the employing facility policy and procedures and legal aspects of care, such as the state's legal scope of practice for nurses, nursing assistants, and other members of the nursing team. The experienced LPN is capable of gathering data and making observations, including noting breath sounds and performing pulse oximetry, right? Y'all most definitely can do that. Can you administer? Sure, you sure can. You sure can. You see what I'm saying? So this is why it's important that you RTFQ, RTFA, and then all together RTFR. Read the fucking rationale. You see what I'm saying? By the way, I'm sorry. If you don't like the F word, it's gonna be hard for you to be a nurse because the nurse's favorite word is the F word. So I'm just letting y'all know. All right. No, I do these six times a day. I do these Monday, Wednesday, Friday at 5:30 Central Standard Time. Question number 9. The charge nurse is making assignments for the next shift. Which patient should be assigned to the fairly new nurse? 6 months of experience pulled from the surgical unit to the medical unit. All right. So is it a 58-year-old on airborne precautions for tuberculosis? Is it a 68-year-old who just returned from a bronchoscopy and biopsy? Is it a 72-year-old who needs teaching about the use of an incentive spirometer? Or is it a 69-year-old with COPD who is ventilator dependent? What are we thinking? So think about it. What type of patient should I give to someone who is new? Not just a new nurse, but a new nurse who got floated to a new unit. Right? When you use your critical thinking in that aspect, that is how you are able to come up with a clinical judgment. That's what the NCLEX wants. They want you to use your critical thinking in order for you to make a clinical judgment. If y'all hear my son in the background, he's terrible too, and like hardcore. So don't worry about him. He good. All right, y'all, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is C, a 72-year-old patient or a 72-year-old who needs teaching about the use of an incentive spirometer. Many surgical patients are taught about coughing, deep breathing, and the use of an incentive spirometer preoperatively. The needs of the client must be competently met with the knowledge, skills, and abilities of the staff to meet these needs. In other words, the nurse who delegates aspects of care to another or to other members of the nursing team must balance the needs of the client with the abilities of those to which the nurse is delegating tasks and aspects of care. So yes, this new nurse, I want to give them something that I know that they can handle. Stable patients, right? Stable, predictable patients. Not the terrible twos. Don't tell me Jenny, I'm letting you know, my dude is terrible twos. You better enjoy that newborn phase, because once they start walking and babbling and back talking, you're going to want to throw the whole kid away. Like, Kobe. No, let me stop. But anyway, so yeah, he's okay. He's fine. Everything's fine. But yeah, so remember, you guys got to read your rationales and understand what type of patient is going to go to those newly nurses that are getting floated, as well as anybody getting floated to a new unit. Okay, so make sure you guys understand that. Return to sender. Look, stop it. Somebody said that to me before, and I'm just like, I can't put them back. Amber says, thank you for making studying fun. I take my NCLEX on the 25th. Shout out to you, Amber. Hey, I try to make this as fun as possible. When I actually taught on the podium as well, I did the same exact thing. So I want to try to make it as informative as possible. Here we go. Question number 10. The high pressure alarm of a patient's ventilator goes off when you enter the room to assess the patient who has ARDS. Make sure you guys know what these acronyms stand for. The oxygen saturation monitor reads 87% and the patient is struggling to sit up. What action should you take next? So systematically, if I was going 1, 2, 3, 4, and I'm on step number 2, what is step number 3? All right. Do I want to reassure the patient that the ventilator will do the work of the breathing for him? Manually ventilate the patient while assessing possible reasons for the high pressure alarm? Increase the fraction of inspired oxygen on the ventilator to 100% in preparation for endotracheal suctioning? Or do I want to insert an oral airway to prevent the patient from biting on the endotracheal tube? What are we thinking? What are we thinking? Shout out to all 465 of y'all. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. You guys go over there and check them out. Make sure you guys share. You guys like. You guys smash that like button. Make sure you guys share. Make sure you guys follow. Make sure you guys turn that notification on so you guys know when I go live as well. And if you're in nursing school, nurseslabs.com has some really good care plans over there. I don't care how you feel about them. They're a part of your curriculum, damn it. So go learn them. All right. But let's see. Let's see what this is in 3, 2, and the answer is B. Manually ventilate the patient while assessing possible reasons for the high pressure alarm. Manual ventilation of the patient will allow you to deliver an FiO2 of 100% to the patient while you attempt to determine the cause of the high pressure alarm. Proper ventilation techniques with the BVM or the back valve mask should consider safe ventilation parameters for each individual patient and their conditions. All right. So everybody keeps saying it's always ABCs. And sometimes it's not always ABCs. What about my level of consciousness? But then again, with your level of consciousness, I can tell you that you have a possible airway, breathing, or circulation problem. All right. So think about that. Think about that. Remember about the high pressure alarms, low pressure alarms. If there's a high pressure alarm, that means that something is blocking something. Okay, so you got to pay attention to that. Hey, they could have a mucus plug. And if you've never seen a mucus plug, it looks nothing like this gentleman here on this book who has a pre-order called Conquer It and the Journey to PASS NCLEX at thebootnurse.com/books. But mucus plugs are nasty. I'm just letting y'all know that right now. They're pretty gross. Low pressure alarm. What about the low pressure alarm? So if I have something blocking, that means that if it's a low pressure, that there's not enough pressure. So that a lot of times when there's a low pressure alarm, that means that the vent is dislodged or the tube came out. Right? Because there's no resistance whatsoever. All right. So, ladies and gentlemen, hey, I have a book. You guys can go over there and pre-order it right now. The book, thebootnurse.com/books. It's the Journey to PASS NCLEX. Hey, y'all, I failed my NCLEX 3 times and I passed on the 4th. And so this book is about inspiration and motivation and the things that I went through and strategies and techniques that I had to fix for myself in order for me to conquer the NCLEX. And a lot of people don't realize that it's them in their own way not getting off their own beach. All right. I'm just letting y'all know. How do I feel about Mark Clinic? I love Mark Clinic. It's great. All right. So I'm just letting y'all know right now. Y'all go check that out. thebootnurse.com/books. All right. It says, you're awesome. Thank you. I failed 3 times as well. Cool. Hey, remember, you're delayed. You're never denied. And like I said, your job will never ask you how many times you took their NCLEX, and your patient will never ask you. So get out of your own way. Here we go. Question number 11. The nursing assistant tells you that a patient who is receiving oxygen at a flow rate of 6 liters per minute by nasal cannula is complaining of nasal passage discomfort. What intervention should you suggest to improve the patient's comfort for this problem? Is it A, suggest that the patient's O2 be humidified? Suggest that a simple face mask be used instead of a nasal cannula? Suggest that the patient be provided an extra pillow? Or suggest that the patient sit up in a chair at the bedside? What are we thinking? All right, what are we thinking? Shout out to all 300 plus of y'all. We're doing NCLEX questions. Hey, we're on the road to 30,000 likes. Make sure you guys smash that like button. You guys share and you guys follow. Every time I do a commercial break and I talk about something, I literally lose like 100 people. So I always think it's funny. Get that pillow? Stop. Get that MFN pillow. All right. But yeah. What are we thinking? We got some A's, we got some B's. And if you're new here, welcome. We're doing NCLEX questions, and I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here, hanging out with us, trying to get your learn on? But here's our answer in 3, 2, and the answer is A. Suggests that the patient's oxygen be humidified. I'm about to say humiliated, but you know what I mean. Buffalo, New York. Erica, you live in Canada. Girl, stop playing. When the oxygen flow rate is higher than 4 liters per minute, the mucous membranes can be dried out. The best treatment is to add humidification to the oxygen delivery system. It is reasonable to use humidified oxygen for patients who require high flow oxygen systems for more than 24 hours or who report upper respiratory discomfort due to dryness. Applications of a water-soluble jelly to the nares can also help decrease mucosal irritation. None of the other options will treat that problem. So, humidified, A, all right? Make sure you guys know it, you live it. Shout out to my RTs. Shout out to I learned everything I ever needed to know about the vent from an RT. And I'm telling you right now, if anybody's going to the ICU, hey, you better find an RT who's going to teach you. Not an RT that's an asshole. I don't care what people say. Like, I'm all about the learning and the education aspect. If you're an asshole, that becomes a learning barrier, an environmental barrier, and, you know, people can't receive the message that you're trying to deliver. So if you're an RT and you're an asshole, fix yourself. Here we go. Question number 12. When a patient with TB is being prepared for discharge, which statement by the patient indicates the need for further teaching? So my patient's not picking up what I'm putting down. All right. So now I need to be like, hey, bro, come here. Let me tell you what you just said that was wrong. Anyway, so is it everyone in my family needs to go and see the doctor for TB? I will continue to take my my isonized until I am feeling completely well. I will cover my mouth and nose when I sneeze or cough and put my tissue into a plastic bag. Or I will change my diet to include more foods rich in iron, protein, and vitamins. What are we thinking? What? B. Okay, I see you. It says B. No need to hear the rest of the options. No, it needs to be. What's up, Bella? I see you. You have to hear all the options. You have to do that. Now, if you go through all the options and then you say B, cool, then I got you. Some of these you will just know, but you got to filter through all of them, because if you don't filter through all of them, you're going to miss it by one word and you're going to be like, well, damn, I probably should have read the fucking answers. So here's our answer. Speaking of that, here's our answer in 3. Somebody said B. So let's see what the answer is in 3, 2, and the answer is B. All right. I will continue to take my ionized until I am completely well. Patients taking ionized must continue the drug for 6 months. The other 3 statements are accurate and indicating an understanding of TB. All right. Drug of choice is ionized. It is usually given with vitamin B12. Is it pyridoxine? It's recommended with the Mantox or quantiferum positive individuals, and should be continued for 6 to 9 months. All about TB. What's up, D? How are you, Miss Lady? Oh, I read it wrong. So you know what that tells me? You didn't read Danelle. That means you didn't read the. Yes, right. I read the damn question wrong. Look at you, Jenny. Already messing up. Question number 13. To improve respiratory status, right? To improve it. Which medication should be prepared to administer to a newborn infant? What respiratory distress syndrome? Is it theophylline, surfactant, dexamethasone, or albuterol? What are we thinking? RTFQ. You better read the question. Ava says, I always say that to myself when I take a test. Good. You should. You'd be like, damn, Ava, read the fucking question, Ava. What are you doing? Ava, just don't smack yourself in the head, because people are going to look at you like you're crazy. I don't need them, committing you. All right. What are we thinking? 15 seconds, y'all. We're on a roll. Y'all are doing well. It said, I have no clue. I haven't taken peds yet. That's okay, Kaylee. Hey, give me a guess. If you guess, you have a 25% chance of getting it right versus, not answering it at all and getting a complete zero. But here's a news flash on NCLEX. You have to answer something. You have to, or else it will not let you go on to the next question. All right. But here we go. Here's our answer. Here's our answer in 3, 2, and the answer is B. It's surfactant. All right. So Exosurf neonatal is a form of synthetic surfactant. All right. An infant with respiratory distress syndrome may be given 2 to 4 doses during the first 24 to 48 hours after birth. It improves respiratory status, and research has shown a significant decrease in the incidence of pneumothorax when it is administered. Look at that. Shout out to y'all for getting it right. If you didn't get it right, circle back. All right. So this is obviously a management of care question, but it's also a pharmacological and parenteral therapies question and a physiological adaptation when it comes to medical emergencies. Right. So, hey, they can pull these from all different types of places. They'll use surfactant. So on NCLEX, they use generic names. They don't use trade names. All right. Because all that'll do, it would be great if you could put Tylenol in there, but acetaminophen it's the way to go. You know what I'm saying? The clinical instructor, not me, which I tried to be me, but nobody called me back, directed the nursing student to care for a client whose potassium is 6.7 milliequivalents per liter. Which intervention is delegated correctly to the nursing student? Give potassium 10 MEQs orally. Do I want to give K-Exolate 15 grams orally? Give spirulactone 25 milligrams orally? Or do I want to assess the ECG strip for tall P waves? All right. Now think about it. Read the question. I'm going to read it slow. And I need for y'all to smash that like button and give me 30,000 likes. So I'm going to read it slow. The clinical instructor directed the student nurse to care for a client whose potassium is 6.7. 6.7. Kate, what's up, Miss Lady? How are you? Hey, anybody that wants to be a paramedic or know the route of being paramedic, go holler at my girl, Matey Kate. She'll get you right. All right. Now, 6.7. Is that good or is that bad? I'll let y'all determine that. Now, which intervention is delegated correctly to the student nurse? Think about it. All right. Yeah, I got y'all wound up right now. Hey, give me the 30,000 likes. Let's make it happen. Come on. 3.5, staying alive. Staying alive. All right. And it is B. Give K-Exolate 15 grams orally. All right. Delegation supervision. Right. The normal range for potassium is 3.5 to 5 because that's how we stay alive. Right. The client's potassium level is high. K-Exolate eliminates potassium from the body through the gastrointestinal system. Hey, remember this for DKA, by the way. OK, the right person must be assigned to the right task and job under the right supervision. The nurse who assigns the task and job must then communicate with and direct the person doing the job or task. Now, let's think about this. Why would I delegate a student nurse, to interpret an EKG? I like Archer. Archer's pretty cool. Think about that. This isn't a shade for anybody. No, not hypo. Hypo means low and hyper means high. Yes, but nursing students can't give meds alone. Now, look at that. Can a nursing student give PO meds under the direction of a nurse? Remember, the clinical instructor is with them. Can they do that under the direction of a clinical instructor and the preceptor? Yes. Would I tell you to go interpret an EKG as a nursing student when you are just beginning? Probably not. This one tripped me up. Vaughn, this is why I say you got to pay attention. It says K-Exolate is by no means a treatment for DKA. I didn't say that it was a treatment for DKA. I said to remember the use of K-Exolate for a patient that has DKA. Didn't say that it was a treatment. The initial treatment for DKA is fluid resuscitation with regular insulin. But whatever, bro. Here we go. Question 15. A patient with COPD has a nursing diagnosis of ineffective breathing patterns. Which is an appropriate action to delegate to the experienced LPN under your supervision? So I'm an RN, and now I'm delegating something to my LPN. All right. So what is it? LPNs, what can you do? Can you observe how well the patient performs pursed lip breathing? Can you do that? Can you plan a nursing care regimen that gradually increases activity and tolerance? Can you do that? Can you assist the patient with basic activities of daily living? Can you consult with the physical therapy department about reconditioning exercises? When you guys are taking your exam, LPNs, you can read it like that and see how much more sense it makes, because when you read it as you're asking yourself a question, you will understand what you can and can't do and what you can and cannot accept. All right. Think about that. There are things that you know that you can do. All right. Shout out to all 460 of y'all. We're doing NCLEX questions, both for RNs and LPNs. I got these off nurseslabs.com. They're free sets of questions. Go over there and check them out for yourself. Make sure you guys smash that like button. Hey, give me the 40,000 likes. Stop playing games. But here we go. In our answer in 3, 2, and the answer is A. Observe how well the patient performs pursed lipped breathing. Experienced LPNs and LVNs can use observation of patients to gather data regarding how well patients perform interventions that have already been taught. The scope of practice for the legal, practical, or vocational nurse must or will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. This is why it is so important that you read the fucking question along with reading your fucking answers, and sum it all up by reading your fucking rationales. You know what I'm saying? Just letting y'all know. But shout out to everybody that got that right. If you didn't get it right, circle back. Management of care, delegation, supervision, and assignment. The largest section on the NCLEX. Whoa, hold on. It says, I passed my NCLEX on 323. I'm officially an RN. I'm so grateful. Bohemian Express. Shout out to you. Hey, ladies and gentlemen. Bohemian Express passed their NCLEX. Hey, give that individual their flowers right now. Congratulations, Bohemian Express. Welcome to the greatest shit show on earth, known as being a nurse. Congratulations to you. If there's one piece of advice that you would give to everyone that's going to take their NCLEX, what would that be? And once again, congratulations to you. Ladies and gentlemen, hey, speaking of all this, I have an NCLEX course. It's called the 7-day NCLEX course. You get a community with that, and you can actually join for $7. That's right, $7. One more than 6, one less than 8. And you can join it for $7 for 7 days. I have 2 NCLEX reviews in there, right? I have 2 NCLEX reviews in there to include content and content being added every month. So you guys go over there, check it out, thebootnurse.com/special. All these are linked to my link tree as well. Hey, I don't care if you're a first-time test taker or a repeat test taker, it works. It works. And I break down questions over there just like I do over here. So make sure you guys check that out for $7. Hey, and you got a community. I actually did a maternal health lecture this morning around 11 and lasted a little bit over an hour. So make sure you guys can go over there and check that out. 30K, let's go. Hey, Lizzie, hey, rally them up. We need 40K. Let's make it happen. All right. Question number 16. When assessing a 22-year-old patient who requires emergency surgery and multiple transfusions 3 days ago, you find that the patient looks anxious and has labor respirations at the rate of 38 breaths per minute. The O2 saturation is 90% with the oxygen delivery at 6 liters via nasal cannula. Which action is most appropriate? What is the most appropriate? Okay, so is it to increase the flow rate of the oxygen to 10 liters per minute and assess the patient after about 10 minutes, assist the patient in using the incentive spirometer and splint his chest with pillows while he coughs, administer the ordered morphine sulfate to the patient to decrease his anxiety and reduce the hyperventilation? Or is it to switch the patient to a non-rebreather mask at 95% to 100% of oxygen and call the physician to discuss the patient's status? What are we thinking? Remember, ladies and gentlemen, think of the nursing process. Do assess before implement. Do I have enough information? Do I have enough information in the stem of the question in order for me to do something? Or do I require more information? Maslow's physical versus psychosocial. Which one comes? Physical always takes priority of psychosocial, right? And then think about your ABCs, LOCs, right? And then after that, I can then apply what I know with my process of elimination. So based off of this, what is the most appropriate thing? If I could do one thing and leave, what would it be? Think about it. RTFQ. Here we go. Here's our answer. I just reread. There you go. Here we go. Here's our answer in 3, 2. And the answer is D. Switch the patient to a non-rebreather mask at 95% to 100% oxygen and call the doctor to discuss the patient's status. The patient's history and symptoms suggest the development of ARDS, which will require intubation and mechanical ventilation. Patients are mechanically ventilated, guarded against fluid overload with diuretics, and given nutritional support until evidence of improvement is observed. All right. So this is why you have to do that. You say you can't administer without an order. Can't administer what? Oxygen? Oxygen is a standing order, and you can administer it as an RN. You most definitely can. Those are standing orders. It is within your scope of practice to administer oxygen. So just letting you know. So and the non-rebreather's not working. The non-rebreather's already maxed. So can you switch from a non-rebreather to can you switch from a nasal cannula to a non-rebreather? You sure can. And remember, on NCLEX, you have the order. You have the order on NCLEX. You have the order. All right. So don't get that confused. Question 17. Which of these medication orders from a patient with a pulmonary embolism is more important to clarify with the prescribing physician before administration? All right. It says, just remember the NCLEX, just remembered it's a perfect world. Absolutely. Absolutely. You have all you need on NCLEX RN Hospital. Absolutely. You sure do. You have all the hands. You have all the people. You have everything. All right. So is it warfarin, 1.0 milligrams by mouth PO, morphine sulfate, 2 to 4 milligrams IV? Is it Keflex, Cephalexin, or 250 milligrams PO, or is it heparin infusion at 900 units per hour? What are we thinking? So what is the problem? What's the problem? Who can name it? What's the problem? And somebody said, I think I just saw it. Just think of it as what I can do before I call the provider. Exactly. The duration. Okay. Blood clot. Okay. Heparin. All right. But you got to think, what is more important? Because these are medications that I'm going to administer. So what about these medications is incorrect? Something is important. All right, let's see. It says hold on. Brandy, it says you don't write orders that way. There's too much. Oh, maybe Brandy. Let's see in 3, 2. And the answer indeed, Brandy, is A. Brandy's a smarty pants. Shout out to everybody that picked A, but it is warfarin, Coumadin at 1.0 milligrams by mouth PO. Medication safety guidelines indicate that the use of trailing zeros is not appropriate when writing medication orders because the order can easily be mistaken for a larger dose, such as 10 milligrams. Oh, Lord of mercy. The order should be clarified before administration. The other orders are appropriate based on the patient's diagnosis. All right. Listen, don't you ever blindly give a medication. If it looks wrong, you better call somebody and you better verify. I'm telling you right now, because they ain't playing with y'all. I'm telling you, and you want to know something? You know who's really not playing with y'all? The Board of Nursing. I don't give a shit what your policy at your hospital says. I don't care what a doctor tells you to do, what they threaten you to do. You better verify, because if not, if you go in front of the board, if you go in front of the Board of Nursing and then they ask you something like that, they're going to be like, oh, wait, didn't you graduate? Didn't you do that? Didn't it say not to do trailing orders? You did not verify with that with the doctor? Oh, they're going to yank that license. They don't give a shit about you. They care about protecting the public. That's what it is. And if you, nursing student, future nurse, cannot get that right, you don't deserve a license. So pay attention. One example, Radonda Vaught. I know I use her as an example, but she is the most recent person to have made a medication administration error. So I'm telling you right now, y'all better pay attention. All right, question 18. You are a team leader RN working with a student nurse. The student nurse is to teach a patient how to use an MDI without a spacer. So you want to put them in the correct order, the steps that the student nurse should teach the patient. So you're going to use every single one of them. You're lost probably because you just got in here. So that's okay. Keep up. Catch up with us. You know what I'm saying? Not mustard, ketchup. Anyway, so is it, you're going to use all 6 of these, by the way. So I'm going to give you guys time. Never trust doctors to correctly order medication. Sincerely, pharmacist. Shout out to you, Bree. You know what the deal is. All right. Let's see what order it is. This is a metered dose inhaler. Correct. You are correct. All right. All right, what are we thinking? Hey, while you guys are filling that out, welcome to everyone that is new here. We are doing NCLEX questions. I got these questions off of nurseslabs.com. They are free sets of questions. It says, I'm so glad I stumbled over to this corner of TikTok tonight. I'm glad, Macy, I'm glad you made it over here. Not in nursing school at all yet. I am here. That's okay, though, because guess what? You are essentially ahead of the game than your peers at the level that you are trying to accomplish. So think about it like that. Hey, remember, nobody's going to give you anything. You got to work for it. So if you got to jump in here early to understand what's going on, cool, do you. It's only going to say your name on your license, and it's only going to say your name on your degree. So just saying. We got CAEFDB. Okay. All right. It looks like the general consensus of that. All right, here we go. Here's our answer in 3, 2, and it's CAEFDB. So shout out to all my smarty pantses out there that got that answer correct. So before each use, the cap is removed and the inhaler is shaken according to the instructions in the packaged insert. All right. Next, the patient should tilt the head back and breathe out completely. Each inhaler consists of a small canister of medicine connected to the mouthpiece. The canister is pressurized. As the patient presses down on the inhaler, it releases a mist of medicine. As the patient begins to breathe deeply through the mouth, the canister should be pressed down to release 1 puff of the medication. The patient should continue to breathe in slowly over 3 to 5 seconds and then hold the breath for at least 10 seconds to allow the medication to reach deep into the lungs. And the patient should wait for at least 1 minute between puffs from the inhaler. So shout out to everybody that got that right. Shout out to all 444 of y'all, Jay-Z style. Remember, you got to put them in order. You got to put them in order. If you got it wrong, circle back and understand that. And if you got it right, also circle back and understand that. What's up, Ellie? I see you. Here we go. Question 19. You are acting as a preceptor. And by this, don't be an asshole over preceptor. But anyways, you're acting as a preceptor for a newly graduated RN during her second week of orientation. You would assign the new RN under your supervision to provide for which patient select all that apply. There's only 4. All right, is it a 38-year-old with moderate persistent asthma awaiting discharge? Is it a 63-year-old with a tracheostomy needing tracheostomy care every shift? Is it a 56-year-old with lung cancer who had just undergone a left lower lobectomy, or a 49-year-old just admitted with a new diagnosis of esophageal cancer? What are we thinking? Shout out to all 400 plus of y'all doing NCLEX questions. Got them off nurseslabs.com, free sets of questions. Make sure you guys smash that like button. We're on the road to 40,000 likes. So make sure you guys smash that like button. You guys share and you guys follow. That is the trifecta that TikTok needs for, I'm trying to go over to those corners of TikTok where people can find me like a lot of y'all did. And also, I want to know if you're new here, who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? I saw somebody that said they're a pharmacist. I think it was Bree. So shout out to you, Bree. But we got A and B. Okay. A and B. I'm new here. Blanca. Doesn't that mean white? That's Blanco. Shout out to Philly. Blanca, I'm glad that you're here. It says, I like to learn. Oh, I like that you like to learn because I like to teach. Shout out to It's Aliens. Hey, I was a surge tech for a long time, and I was also a surge tech instructor for 3.5 years. That actually started it all right there. Here we go. And the answer is B. A and B, sorry. So a patient who is waiting for discharge may be stable enough for the care of the student nurse. The client is the center of care. The needs of the client must be competently met with the knowledge, skills, and abilities of the staff to meet these needs. It's something that you can very easily teach student nurses as well as teach new grads, right? And also with B, a new RN is at an early point of her orientation. The most appropriate patient assigned to her are those in stable conditions who require routine care, right? Just like that. So shout out to everybody that got that right. I'm a military medic studying for the NCLEX. Okay, so you're a medic, what, in the Air Force, in the Army? I was a corpsman in the Navy for 16 years. I actually taught a lot of the 68 Deltas and the 4N1s for the Air Force. So I know a little something about all the branches. So shout out to everybody that got that question right. But here we go. Shout out to D-Town. Question number 20. Jenna is a nurse from the medical surgical unit in a tertiary hospital. Thank you for your support. I appreciate that. Somebody just said they took their NCLEX. Okay, shout out to you. She was asked to float to the orthopedic ward in which she has no experience working on. I'm starting to see a trend here. All right. Which client should be assigned to her? Is it a client with a cast for a fractured femur and who has numbness and discoloration of the toes? A client with balanced skeletal traction and needs assistance with morning care? A client who has an above the knee amputation yesterday and currently has a temperature of 101.4? Or is it D, a client who had a total hip replacement 2 days ago and needs blood glucose monitoring? What are we thinking? What are we thinking? Everybody screaming D at me. Hey, if you guys are new here, a little bit about me. I was in the Navy for 16 years. I've been a nurse for 3.5 years. I've worked ICU, OR, and I worked PACU. And I failed my NCLEX 3 times. Yeah, not once, not twice, but 3 times. I'm actually writing a book about that whole journey because I want it to be inspirational to those taking it for their first time or if they're taking it multiple times. All right. And no part of me gives a shit about what anybody has to say about the fact of me failing because you have no idea what I had to go through, just like I have no idea that what you had to go through. So don't let these people that are out here who don't know nothing about you tell you you don't deserve to be a nurse. If you ever hear somebody say, oh, maybe you should do something else. Hey, you need to get rid of them. Get rid of them completely. Take them out your phone, delete them off or whatever. I'm telling you right now, because that doesn't help you. That does not help you progress in the direction that you need to go in order for you to conquer what you're trying to conquer. All right. Just letting y'all know. I don't got friends. I don't got friends now. I'm just letting y'all know because people come and go. Those seasons are gone. Don't let people play with y'all. Don't let people play with y'all. I failed NCLEX PN 3 times and I'm scared of taking. Hey, if you scared, go to church. All right. But guess what? You're going to go to church scared. So guess what? You're going to take the NCLEX again and you're going to do it scared anyway. You see what I'm saying? You need to get off of your beach. All right. But the answer is D, a client who had a total hip replacement 2 days ago and needs blood glucose monitoring. A nurse from the medical surgical unit floated to the orthopedic unit should be giving clients with a stable condition as those who have similar or care similar to her training and experience. A client who is in a post-operative state is more likely to be in a stable condition. All right. So shout out to everybody that got that right. All right. So, hey, on the med surg floor, do they check post-op patients who need their glucose checked? Doesn't say anything about them being unstable. And remember, they had surgery 2 days ago. It doesn't say that they're freshly out of a surgery. You see what I'm saying? They're not acute. They're stable. Just saying. This is why you have to read your questions, but you also need to read your answers. And when you read your rationale, it helps you retain the information. It all goes full circle. And if your circle is only half, you better circle that ass back to content and you better get to learning. Just letting you know. But ladies and gentlemen, hey, speaking of those individuals, hey, remember, like I said, I failed NCLEX 3 times. I passed on the 4th. One of the biggest things that I got is I got a mentor. It came out of nowhere. It's like the clouds opened up and God said, I hate you, Alfalfa. No, shout out to the little rascals. But no, I got a mentor, y'all. And that individual pointed me in the right direction that I needed for myself. And the one thing I said, I was always going to give back to the people that I needed to do that for. So if you're one of those individuals who struggled with the NCLEX, failed the NCLEX, don't know where to start, lack accountability, don't understand NCLEX style questions, don't understand content, how to apply them and use critical thinking, come holler at me. thebootnurse.com/coaching. I have a 100% pass rate for every person that I've coached, every single person. So if you're one of those people that's coachable and you're ready to get to work, because I am not about the games, come holler at me, bootnurse.com/coaching, and you can find that link in my bio as well. All right, here we go. Question number 21. Which intervention for a patient with a pulmonary embolus could be delegated to the LPN on your patient care team? All right. It says the most important thing I learned in nursing school is not to compare to other facts. Kimberly, let them know. It says, do you recommend the 7-day NCLEX course before the NCLEX? Absolutely. It's my course. So why would I not recommend it? I would recommend you do it. I would recommend it to anybody. All right. But what's the answer? Evaluating LPNs. Can you evaluate a patient complaining of chest pain? Can you monitor laboratory values for changes in oxygen? Can you assess for symptoms of respiratory failure? Can you auscultate the lungs for crackles? Can you do that? Do I coach for LVNs? Absolutely. They're nurses, are they not? They're nurses. Just saying. LPNs, when you guys go in and they give you these delegation questions, ask yourself, can I evaluate? Can I monitor? Can I assess? But make sure when you read those, you read the answers all the way through. Okay. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D. Auscultate the lungs for crackles. Oh, I know y'all about to be mad, but let's see why. We finna see why. Finna, F-I-N-N-A, finna, all right? So an LPN who has been trained to auscultate lung sounds can gather data by routine assessment and observation under the supervision of the RN. The scope of practice for the licensed practical or vocational nurse will most likely include the legal ability of this nurse to perform data collection, plan, implement, and evaluate care under the direct supervision and guidance of the registered nurse. All right? Just like, hey, look, understand it. Understand. And by the way, it's not always about this. You need to you have to read this to understand why it's correct, but read these to understand why the answer that you chose, if you got it wrong, why it is incorrect. The whole point is to get y'all into a routine. I have so many people say, I don't know where to begin. Hey, stop playing with me. Stop playing games with me. All right. Get off my phone playing games. Get off my TikTok playing games. All right. Y'all can come here every day or every other day at 5:30. But then when I'm so lost. How you lost when you can come find me at 5:30? You mean to tell me you can schedule to be here at 5:30, but we can't schedule to look over those areas that I can't, that you are having trouble on? Come on. Get with the routine. Get with it. Hold on a second, y'all. Apparently TikTok does this verification thing. It's weird. They were going to shut my live off. That's crazy. The nurse plans to care for a client in the post-anesthesia care unit. Which of the following should the nurse assess first? Is it A, respiratory status, level of consciousness, level of pain, reflexes, and movement of extremities? What are we thinking? Now, I want you to think about this. Post-anesthesia care unit. Where is this patient coming from? Where is this patient coming from? All right. Post meaning after. Right? Think about it. They're coming from surgery or they're coming from some type of procedure, right? So anesthesia, 9 times out of 10, they're getting some heavy drugs or they're getting, they were intubated, right? So what's the first, they're coming to the PACU. What's the first thing I want to do? All right, here we go. Here's our answer in 3, 2, and the answer is respiratory status or status, if you're bougie. Assessing respiratory status is the first priority. Remember ABCs: general anesthesia and mechanical ventilation impair pulmonary function, even in normal individuals, and result in decreased oxygenation in the post-anesthesia period. They also cause a reduction in functional residual capacity of up to 50% of the pre-anesthesia value. Why? Because they get paralytics. So guess what? The body has to filter all that out and get rid of it. I'm coming from surgery where I had heavy drugs and I was intubated. Now I'm coming to a place where I am on my road to recovery. So the first thing I'm worried about is those drugs wearing off. My airway and those drugs wearing off. You see what I'm saying? Airway. Make sure you pay attention. Read your rationales on why it's correct, but also read on why they are incorrect. All right. Here we go. Question 23. Nurse Jackie. I think there's a Netflix show about that, but Nurse Jackie is reviewing the diet of a 28-year-old female who reports several months of intermittent abdominal pain, abdominal bloating, and flagellants. The nurse should tell the client to avoid what? Fiber, broccoli, yogurt, or simple carbohydrates. What are we thinking? Shout out to all 400 plus y'all. Hey, we are on the road to 40,000 likes. Give me the 40,000 likes right now before I get to question 25, or I'm boycotting. I know we're not in February no more, but I'm going to do it anyway. No, let me stop. But hey, yeah, smash that like button. You know what I'm saying? By the way, if you're new here, we got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. And if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? Oh, by the way, hey, if you don't like the fact that I talk too much, I also don't care. Here we go. In 3, 2, and the answer is B. It is broccoli, because broccoli is known to be a gas forming, which can lead to the bloating and therefore should be avoided. In general, gassy foods are those that contain certain sugars, so fructose, lactose, ranfenos and sorbitol, and or soluble fiber. Soluble fiber. These substances are not digested at the level of the stomach and thus make their way down to the intestines where bacteria eat them down. The end result is the end result of this breakdown is the release of gas. All right. Diet. Understand it. Understand it. I said yogurt, not plain yogurt. Exactly. It said yogurt, not plain yogurt. There you go. Hey, RTFQ, RTFA, and RTFR. See what I'm saying? NCLEX next Friday, or NCLEX on Friday. Shout out to you, tall personality. Hey, tall personality, how tall are you? Like tree tall? Like, what are we talking? So proud of you. All you just keep doing up the work. Okay. Hey, y'all heard her. She's proud of y'all. I'm proud of y'all too. Lord have mercy. Question 24. Question 24. Nurse Manasa of the Boot Nurse Medical Center, shout out to my medical center, is planning care for a client who underwent a colposcopy. Which of the following actions should the nurse take first? All right. What is the very first thing that you should do? Should I discuss the client's fears regarding potential cervical cancer, assist with silver nitrate application to the cervix to control bleeding, give instructions regarding douching and sexual relations, or administer pain medications? What are we thinking? Now, this is where we go back to pathophysiology. What is a colposcopy? What is a colposcopy? Think about it. Whoa, somebody passed? Hold on. Somebody tell me that they passed. Did I miss it? Hey, if I missed it, I'm sorry. Oh, man, I think I missed it. Oh, well. Graduated my BSN in May. Shout out to y'all. Colon polyps. Oh, polyps. I'm sorry. It says where they take cervical cells. Okay. Oh, Juicer pass. I'm sorry, Juicer. I didn't see that. Congratulations to you, Juicer. Welcome to the greatest shit show on earth. And it is a shit show, let me tell you, called Nursing, RN and LPN. If there's a piece of advice you could give, what would that advice be? And once again, congratulations to you. But let's see what the answer is. In 3, cervical biopsy. All right, Ava. Ava, did you just Google that? You Googled it, cheater. Here we go. Here's our answer in 3, 2, and the answer is B. It's to assist with silver nitrate application to the cervix to control bleeding. Colposcopy is a procedure to examine the cervix, vagina, and vulva for signs of disease. The priority nursing action when caring for a client who underwent a colposcopy is to assist in controlling potential bleeding by applying silver nitrate to the cervix. Manny, you telling me that you knew it? Would you pick though? If you knew it, you better have picked the right answer. It says, do you go live every Wednesday around this time? I go live every Monday, Wednesday, Friday at 5:30. So make sure you follow and you turn on those notifications because I may go early, I may go late, so it all just depends. Manny, you lying. I know you didn't pick B. Don't lie to me. Don't lie to me, girl. Don't lie to me. But make sure you guys read your rationales. Okay. I believe you, Manny. I believe you. All right. Here we go. Question number 25. Sally is a nurse working in the emergency department and receives a client after a radiological accident. All right. Which task is the utmost priority for the nurse to do first? So we're talking about a radiological type of accident. So think of Fukushima, think of Chernobyl, but a lot of people live. Is it A, decontaminate the client's clothing, decontaminate the open wound of the client's thigh, decontaminate the examination room the patient is placed in, or save the client's vomitus for analysis by the radiation safety staff? What are we thinking? Shout out to all 400 plus y'all. We're doing NCLEX questions. Make sure you guys like, share, and follow. That is the trifecta to take me to the corner of the FY page so people can come over here and be my friend because I'm lonely over here, bro. I'm lonely. Nurseslabs.com is where I got these questions. Nursing students, if you are in the process of trying to learn your care plans, go over there and check out nurseslabs.com. They saved me when I was in nursing school, when I started in 2017. So hey, go over there and get you some. Go over there and get you some. All right. 10 more seconds, y'all. Everybody screaming B at me. Kip, thank you for the follow, my good sir. Joanna and Brianna, thank you for the follow. But here's our answer. Here's our answer in 3, 2, and the answer is B. It is to decontaminate the open wound on the client's thigh. Why? Well, I'm finna tell you why. Decontaminating an open wound is the first priority for the client. This minimizes the absorption of radiation in the client's body. A radiological accident is an event that involves the release of potentially dangerous radioactive materials into the environment. This release is usually in the form of a cloud or plume, and could affect the health and safety of anyone in its path. Luckily, there's nothing that's been done at that level in a large capacity since the 40s. So, just be aware of that. Just be aware of that. All right. But make sure you RTFQ and you RTFR. OK. And also RTFA. You are reading fucking everything. You better read it. All right. So understanding that this is part of a biological, chemical type of warfare and what to do. The NCLEX is weird. I don't disagree with you. But as hindsight's 2020 for me now, with my critical care aspect and me doing the NCLEX stuff over and over and over, I don't think it's bad, but that's just me though. But ladies and gentlemen, here's the proof in the pudding. Somebody asked me about LPN. This young lady right here, Helen, worked with me for 30 days and she passed her LPN. This young lady right here, Joy, used a 7-day NCLEX course and she passed in 150 questions in January. And these two individuals right here, my man AJ and this young lady Crystal, she failed 3 times, y'all. And he passed on his first attempt. Right? All with coaching. Hey, listen, get out of your own way. Do what you need to do for yourself. And if coaching is what you need, come holler at me. If the NCLEX course is what you need, come holler at me. You know what I'm saying? But also, you can use the free download. That works for you too. Whatever is your cup of tea. Okay? Whatever your cup of tea is. Totally taking my LPN in the fall, then RN. Shout out to you, Nessa. Question number 26. A client presents to the emergency department with dyspnea, chest pain, and syncope. All right. Dyspnea, chest pain, and syncope. The nurse assesses the client and notes the following assessment cues: pale, diaphoretic, blood pressure of 90/60, and respirations of 33. The client is also anxious and fearing death. Which action should the nurse take first? Now, what should you take first? Now, is there enough information in this question to implement, or do I need more information? No, I think I can go ahead and I can implement, right? Now, I think about Maslow's. Think about Maslow's. Physical versus psychosocial, right? And then we're thinking about ABCs. All right, so is it administer pain medications, administer IV fluids, administer dopamine, or administer O2 via nasal cannula? Now. Here's where the critical thinking comes into play. You have a patient who is dyspneic, who has chest pain, and who has syncope. Now, they are pale, diaphoretic, and a blood pressure of 90/60 with a respiratory rate of 33. What do you think? Why does my patient have a blood pressure of 90/60? What? If I have a blood pressure that is 90/60, do you think I would be pale? Do you think I would be diaphoretic? And do you think that I would have a respiratory rate of 33? I don't know. Maybe, right? So what is the very first thing that I want to do? That's the key word. The key word is first. The key word is first. All right. But let's see what the answer is in 3, 2, and the answer is D. It is to administer oxygen via nasal cannula. Now, here we are, right? Listen, the promotion of adequate oxygenation is the most vital to life and therefore should be given the highest priority by the nurse. All right. When the nurse needs to prioritize patients, Maslow's hierarchy of needs theory is used to decide which patient is to be seen first. A part of Maslow's hierarchy of needs, airway, breathing, and circulation, which are physiological elements that are needed for the body of survival and help determine one's level of health. They got it right. ABCs, airway, they're dyspneic, right? But then second priority would be what? Right? Their mental status, or they're in acute pain, right? Impaired urinary elimination, right? Hey, we also got to fix that blood pressure. All right. Everything goes in a specific order. What is the very first thing that you could do? He tricked me. I didn't trick you. I just read it. because the critical thinking aspect you have to get down. I didn't trick you. I didn't make you change your answer, ma'am. Come on. Come on. Shout out to you, Donnie. Here we go. Here's our next one. And question number 27. The nurse enters a room and finds a patient lying face down on the floor and bleeding from a gash in the head. Which action should the nurse perform first? What's the very first thing that I should do when I find this patient with, face down and blood, right? Determine the level of consciousness, push the button to call for help, turn the patient face up to assess, or go out in the hallway, get the nursing assistant to stay with the client while the nurse calls the physician, which is very wild. It's wild out here, y'all. It's wild. Vanessa, thank you for the follow. Hey, if you guys are new here, welcome. We are doing NCLEX questions. All right. Don't turn in case of C-spine. Okay. Check the client first. Okay. Hey, I got these off nurseslabs.com. They are free sets of questions. Hey, I need a partner in Baltimore. You mean in Baltimore? In Baltimore? Shout out to OI1 West. I don't know what that means. All right, we got a bunch of people saying A. We got some B's. We got some C. Maro says C. Okay. All right, let's see what the answer is. Here is our answer in 3. It says, what if the client's taking a nap? Stop it. In their own blood? Hey, whatever. Tomato, tomato. But the answer is A. Determine the level of consciousness. Assessing the level of consciousness should be the first action when dealing with clients who might have fallen over. The initial step is to evaluate the reactivity using objective measures. Address the patient verbally, progress to light shaking, and then progress to more intense mechanical stimulation. Hey, sir, can you hear me? They probably can't. Yes, sir. Hey, you already know what the deal is. Shout out to all 600 of y'all. Hey, remember, read your question, right? Understand what the answers are asking you, and then read your rationale. All right? It says you don't move them until the provider comes or make them safe and okay on the floor. Are you asking me? Are you telling me? Because I'm about to say damnable lie. We definitely, if they're in blood, we definitely can't leave them like that. But it's asking you what you do first. All right? So, Dr. ABCD, shout out to you. Here we go. It says, why am I just making it to this side of TikTok? Now, fine, China. That's what I'm talking about. They smashing that like button and the TikTok gods brought you to me. So I appreciate you being here. Question 28. You are admitting a patient for whom a diagnosis of pulmonary embolism must be ruled out. The patient's history and assessment reveals all of these findings. Which finding supports the diagnosis of pulmonary embolism? The patient was recently in a motor vehicle accident. The patient participates in aerobic exercise program for 6 months. The patient gave birth to her youngest child 1 year ago, or the patient is on bed rest for 6 hours after a diagnostic procedure. What are we thinking? What are we thinking? Shout out to all 400 plus of y'all. We're doing NCLEX questions for those that are new here. I do these questions every Monday, Wednesday, and Friday at 5:30 Central Standard Time, PM. Somebody literally asked me, oh, is this 5:30 a.m.? What in the actual hell? Really? We got 25 people that are saying D. Shout out to all the follows. I appreciate everybody for the follows. Queen, Jasmine. All right. So here we go, y'all. Here we go. Here's our answer in 3, 2, and the answer is A. The patient who was recently in a motor vehicle accident. Right? Patients who have recently experienced trauma are at risk for deep vein thrombosis and pulmonary embolism. PE remains relatively common after trauma and occurs in the absence of lower extremity or spinal fractures. Although PE is usually thought to occur between 5 to 7 days after the injury, data suggests that as many as 37% of pulmonary emboli occur earlier. So you always have, when they're a motor vehicle accident, y'all think that shit is easy on the body? No. Somebody's going to have internal bleeding somewhere, possibly, right? Or they're going to have lack of movement for a couple of hours, right? You got to think about that. Because most people, when they get into motor vehicle accidents, they don't want to get up. They don't want to move around. I just got bamboozled by the NCLEX. Hey, Blanca, come on. Hey, we got to fight through it. Don't get bamboozled. Don't get hoodwinked. You know what I'm saying? We here for that. What in the hell? We here for that. All right. So this is why it's important that this is why it's important that we read our rationales, okay? And we read our questions and our answers. And if you don't know, circle back, get the content. All right, here we go. Is it Maka, Becca, Rashonda, May? Thank you for the follows. Appreciate you. Question number 29. There you go, Ellie. You know what's up. Geraldine, I see you. Question 29. You are assigned to provide nursing care for a patient receiving mechanical ventilation. Which action should you delegate to an experienced nursing assistant? Now, can a nursing assistant assess the patient's respiratory status every 4 hours? Can a nursing assistant take vital signs and pulse oximetry readings every 4 hours? Can they check the ventilator settings to make sure that they are as prescribed? Can they observe whether the patient's tubes need suctioning every 2 hours? Can they do that? None of the above? Kip, you are wrong. It is one of them on here. What are we thinking? I got 40 something people. I take it tomorrow. Haley, you take it tomorrow. Hey, you got two choices, Haley. I'm either going to block you or you go away. And I'm telling you why. Because this is what I consider cramming. Okay? You don't need to be cramming the day before your exam. You need to be relaxing as much as possible. Hey, go watch Demon Slayer. All right? I recommend go watch Demon Slayer. Everybody that's taking their NCLEX tomorrow, go watch Demon Slayer. Go do something else. All right? Because if you don't know it by now, you don't know it at all. I'm telling you right now. There's no need for you to cram. There's no need for y'all to cram. There's no need for y'all to be here. Because y'all already know the information. Y'all already know it. Yes, go watch Demon Slayer. Y'all know what's up. All right, go watch Demon Slayer. Okay, and of course, the answer is B. Taking vital signs and pulse oximetry readings every 4 hours. All right, every 4. I'm an RT school. Let me handle that vent. Hey, you can't always handle the vent. I was ICU nurse, and let me tell you something right now. I never always had an RT, so I had to do things on my own. Right, so. The nursing assistant's educational preparation include measurements of vital signs and an experienced nursing assistant who know how to check oxygen saturation by pulse oximetry. Remember, the staff members' level of education, knowledge, past experiences, skills, abilities, and competencies are also evaluated and matched with the needs of all of the patients in the group of patients that will be cared for. All right. Understand what their scope of practice is. Hey, I went to the movie theater to go see Demon Slayer. I don't know why. I don't know why. All it was an interlude between what was it, the last freaking the last season and now the Hashira season. Like, I'm mad. I spent money on that. But I did go to Alamo Draft House and I got loaded cheese fries and it was the shit. But shout out to y'all who got it right. And if you didn't get it right, circle back. Is it Annalie? Thank you for the share. Nurse Bon or Nurse BON. Thank you for the follow. Appreciate you. Question number 30. It had the new episode. I would have rather saved the money and washed it at home, but that's just me though. Question number 30. You are caring for a patient with emphysema and respiratory failure who is receiving mechanical ventilation through an endotracheal tube to prevent ventilator-associated pneumonia. I may have said that earlier. Which action is most important to include in the plan of care? Is it administer ordered antibiotics as scheduled? Is it hyperoxygenate the patient before suctioning? Is it maintain the head of the bed at 30 to 45 degrees? Or is it suction the airway when coarse crackles are audible? Mackenzie, you got to give me one. Shout out to all 530 y'all. We're doing NCLEX questions. I got them off nurseslabs.com. Those are free sets of questions. You guys check them out for yourself. Hey, get me to 50,000 likes. Am I a respiratory therapist? No, I am a registered nurse. I worked ICU. I worked OR. I worked PACU. I became very familiar with the vent. Because of the respiratory therapist that I worked with in the ICU and the nurse practitioners that I worked with. Shout out to Jana. I love her if she's ever on here, but she's never on here. So what are we thinking, y'all? What are we thinking? All right, we got some D's, we got some C's, we got some C's. Is PACU difficult? Anywhere is going to be difficult if you don't have the right mindset for it. I love the PACU, but I went to the PACU already having ICU experience. Jenny, thank you for the rose. If you don't have the right mindset for it. I love the PACU, but I went to the PACU already having ICU experience. Jenny, thank you for the rose. C, research indicates that nursing actions such as maintaining the head of the bed at 30 to 45 degrees decreases the incidence of VAP. All right, not WAP. Weirdos. These Actions are a part of the standard of care for patients who require mechanical ventilation. I got it right, baby. Well, that's what I'm talking about. Proper positioning, keeping the head of the bed between 30 to 45 degrees, and encouraging early mobility and mechanically ventilated patients aid in the prevention of VAP. Is it OCO? She says, yo. That's what I'm talking about. Hey, I literally, when I worked in the burn center, I saw intubated patients that had they were on like a propofol drip that was still awake and stood up at the side of the bed. I'm just like, this man's a monster. He's a straight monster. I don't know what he was on, but I kind of wanted it. That dude was super strong. So if you got it wrong, circle back. If you got it wrong, circle back. All right. My sister did that. Blanca, your sister is strong. So whatever she's on, you get on it. All right. But ladies and gentlemen, of course, hey, circling back. Hey, I got test taking tips that are over there to help you conquer the NCLEX. That's a 42-page PDF. It's free. Go over there and check it out for yourself. I also have an ebook called the NCLEX Victory Guide, because the road to conquering the NCLEX begins with you and only you. Stop making excuses about what wasn't provided to you. You need to get off that. All right. And you need to take your own journey into your own hands, understand where you did wrong, and improve upon it. All right. You can check that out at the bootnurse.com/victory. Also, 7-day NCLEX course. Hey, you can join the course plus the community for $7. You can join it for $7. I actually did a lecture over there today for maternal health, which is a part of the NCLEX test plan. I don't know if you guys know that, but it is. And it's for a limited time for $7, and then it's gonna go to a subscription base. All right. And of course, if you're one of those individuals who needs help on NCLEX, you failed NCLEX, or you're just nervous going up for your first time and you need guidance, check me out. thebootnurse.com/coaching. Shelly says, he's right. Take your own actions and accept facts. Let them know. Do you do live classes for the course? I didn't get a notification. What are you talking about, Donnie? I did do a live class today, and you have to have your notifications on. Because I even test it to my own email, and I get the notifications when I'm doing stuff inside of the community. All right. So, ladies and gentlemen, that is a wrap. I appreciate everybody hanging out and participating. Y'all didn't get me to 50,000 likes. I'm a little salty about that. Is it Liz Hernandez? Ma'am, thank you for the roses. I appreciate you. What days do you do the classes? They're actually scheduled inside of the NCLEX community. It says, thank you, bro. You're a big help. My man, Nacho. Okay. I appreciate you. I'm glad that this was helpful. All right. Also, like I said, I got these questions off nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. Nurse for Life, thank you for the roses. I appreciate you. Hey, we at 50K, baby. I appreciate y'all. Wish you luck. I don't need to wish you luck if you've been doing your thing. You got it. Go out there and conquer. UJ, I appreciate you. Thank you for the rose. 7-day NCLEX course, y'all. $7. Y'all spend more on Starbucks. Stop playing games with me. All right. So you can check it out at thebootnurse.com/special. Also, there's a free download. Hey, check out my book. It's on pre-order right now. Conquer It, The Journey to Conquering the NCLEX. Hey, it's an inspirational and motivational book. It's coming out on June 5th, which is my 4-year anniversary of becoming a nurse. All right, Geraldine, I appreciate you. I'm glad that this was helpful for you. Marcy, send me a DM. I have to get the $7. Hey, get that $7 though. And of course, if you need help or coaching for the NCLEX one-on-one, where it's very personal, you guys can holler at me, thebootnurse.com/coaching. I got a couple more minutes. I'm going to turn this camera around. Hey, check the hair out, bro. Hey, what's up? How y'all doing? It says, is NCLEX done in Canada? Yes, it is done in Canada. It is very much done in Canada. Shout out to you, Blessed G. Thank you so much. You're awesome. No, resilient. ! You are awesome. How y'all doing? Hey, allergies is really getting me, y'all. Hey, it's actually getting better though. It's actually getting better. Talk to an allergist, all that good stuff. UJ with the top 65. Ma'am, I appreciate you. I appreciate you a lot. Thank you. Thank you so much. You're awesome. No, you're awesome. I already said that. I want to do what? You want to do what? Hey, so ladies and gentlemen, I got a couple of questions. Can you coach me? Absolutely, I can coach you. Nice hairdo. Thanks. I picked it out. Usually, hey, there's some grays in there. I call that deployment and fatherhood. That happens. So whatever. Any tips for CNA transitioning to LPN? Unlearn everything that you thought you knew when you were working, and you're going to relearn everything. Be able to absorb that. It says, thank you. I did not get the notifications of this live stream today. Yeah. If you guys follow me, for everybody, make sure you guys turn your notifications on so you know when I'm going live. Okay. Thank you so much. This was helpful. Maya, you are very welcome. Like I said, hey, if you guys are just joining, we did NCLEX questions, literally just finished those. We do them every Monday, Wednesday, Friday at 5:30. My name's Kevin. I'm a nurse Been a nurse for 3.5 years. I've worked ICU, OR, and I also worked PACU. I like the PACU a lot. The OR was also great because, hey, you get one patient at a time. One patient at a time. It says, was at work today when you were on. I had to go grab them AirPods. Hey, Hunter, I see you. Hunter, I'm going to send you an email, by the way. I see something scheduled for you on the 8th, and we could probably do it earlier. If we can do it earlier, I would rather do that. Any advice for someone that takes the exam on the 18th of March? Vibe. Here's what I'll tell you is my suggestion is make sure you're getting enough rest in between studying. Everybody gets so hung up on, I need to do this many questions, this many days. Make sure that you get enough breaks in between there. Make sure you understand what the testing center looks like. In the Navy, military, we say train how we fight, know thy enemy. I know exactly where that test is at. I know exactly what building it's in. I know exactly how they're going to ask me these questions. So why would I not practice to that? All right. Make sure you're doing your questions. Make sure you're doing your rationales. Make sure you're still taking in that content, because you'd be so surprised on how much you would lose out of nursing school. Okay. Let's see. I taken it almost a month, third attempt. I need your coaching. Ellie, you already know where to find me. You know where to find me, Ellie. Go fill out my questionnaire, schedule a call with me, and we'll get it on and popping. Any advice for advanced healthcare? So resilience, I'm assuming that you are like in MedSearch 2 or something along the lines of that. It says, please, how do I turn on the notification? My sons are not on social media. There should be a bell. There should be a bell somewhere when you follow. Go to my page, and when you follow, there should be a bell, and you can tap it and it turns it on. A day before my NCLEX RN exam, I had a good passing chance on UWorld. All right, hey, you're good. If UWorld's telling you that you're good, cool. Me personally, and this isn't to scare you, UWorld told me the same exact thing. I had high chances of passing, failed. Second time I used UWorld, same thing, failed. Third time, failed. I was like, all right, bro, I'm not using this shit no more. So me and UWorld didn't get along like that. For me, in the end, it was Mark Klimick and it was Kaplan, two of the ones that I still love to this day. But I created my own NCLEX course now, so I always recommend mine first. That's what I always do, and I can do that, right? So, any tips for new grads assigned to the ICU? Is it Lilia? Lilia, here's what I'll tell you. Number one, be a sponge. Okay. Number two, oh my goodness, I just drew a blank. Number two is, if you don't have a good preceptor, find a good preceptor. So if you and your preceptor don't vibe, or if they're rude, they're disrespectful, they're condescending, find a new one, because all that's going to do is hinder your learning, and all it's going to do is it's going to chase you out of the ICU where you really want to be. So I don't want that to happen to you. Always ask questions. And orientation, I know now for the ICU, which is complete bullshit, is like 12 weeks for people. 10 to 12 weeks, and they try to take you off early because, we're in a nursing shortage. If you need more time, open up your mouth and say that you need more time. Because I'm telling you right now, they are going to try to force you off of orientation around that time. And if that's not what you like, or that's not what you need, that's okay. And also, if the ICU is too fast for you, it's okay for you to leave. It's okay. Listen to me, all 123 of y'all. It is okay that you switch from an area of nursing that you thought was right for you, and then you moved for better understanding of your craft and your mental health. It is okay. I worked ICU for 1 year and 3 months. I was gassed. I was burnt out. I had to go. There were too many factors mentally for myself, and there were too many things that were happening in my facility where I was like, nah. Other people want to try to hold that shit on their sleeve. No, it took me 4 times to get my license. Y'all ain't gonna fucking play with me. So that's my advice that I would give to you, is to always be aware that ask tons of questions, take notes, you know what I'm saying? And yeah, that's what I would recommend. It says, do you recommend a technique for me to pass the exam? My technique for you to pass the exam is to study for it. I don't know if you're new here, but I meant that when I said it. I feel like I start to blank out after 85 for anxiety happening both times. I don't think content. It very well could be the endurance that you have to build up. Okay. You need to be able to build up the endurance when you are taking this exam. You have to. You got to build that endurance up. All right. Because guess what? If you can go in there and sit for 85 questions, you could get 85 questions and then be done. But imagine if you were only doing 20 questions a day or 30 questions a day. And this is my philosophy, my opinion. You know, you take it with a grain of salt, but this is what worked for me. And this is what I have teach my coaching students to do. And it's worked for them. Go in there and practice doing the minimum of 85 and build that endurance. Build that endurance. All right. Didn't think of that. How about ATI testing? Is it good for Lex? I couldn't tell you. I never used ATI. But everybody I know that use ATI, they fucking hate it. If it's anything like Hesse, I fucking hated Hesse. Could not stand it. Sorry, my thing. My man Hunter said, preach. MD. Wait, what did I say that was funny? Ellie, you are very welcome. Hey, so what other questions do you guys have? ATI is cheeks. I don't know if that's like a North Carolina thing. I don't know if that is... By cheeks, do you mean ass? Like ATI is ass? Like it's terrible? I don't... Like Hunter, you better bring it back. You better bring it back and use layman's terms with me. Oh, it blows. See, now Ellie, that makes more sense. I appreciate you. That's what they are making us do. Of course, Lex, that's what they're going to make you do because it's integrated into their program. Yeah, bro. I got you, Hunter. I pretty much picked up. If you're anything like AJ Hunter, I know exactly the lingo. All right, so that's why I was like, I think I know what he means. But let me see. I use UWorld, but I don't think that worked for me, and that's okay. I use UWorld and it didn't work for me. Remember, there's tons of reviews out here that do work. They do work, to include mine, but it may not be your cup of tea, and that's okay. Sometimes you gotta go through a couple of cars before you find a good one, right? Right? Just saying. What time are these lives always start? Monday, Wednesday, Friday, 5:30. Make sure you follow me. Turn on the notification bell. Because sometimes I might go early, sometimes I might go late, sometimes I might not go at all. I need to get yours, Kevin. Get it then. Make it happen. Make it happen. All right. What other questions do you guys have? I think I skipped somebody. Where's where did she go? I hope I answered her question. Let me see. Hey, if you guys are just now joining, I did NCLEX questions. I do NCLEX questions Monday, Wednesday, Friday at 5:30. Let me see what other questions you guys. It says for sure AJ, the brother from another. I bet. Hey, that's my dude. He and I were in Jacksonville together. I'm pretty sure he told you about that. I'm pretty sure that's how you found me. So, yeah. What else we got? What other question you guys have? Hey, if you guys don't have any other questions, hey, I got spaghetti I got to go eat. You know what I'm saying? Hey, and look, I got so many pieces of content that I'm working on right now to include fundamentals that you need to know for NCLEX to help you out, maternal health, which is what I did today. The $7 NCLEX is go look at the link, my link tree in my bio, and it'll pull her up right there, and it'll take you directly to the page. What else am I working on? Pharmacology, med surg aspect, psych, whole cardiology section. Eat some for you. It's finna be good too. I ain't gonna lie to you. Go grab some good, my guy. Talk to you soon. Appreciate it. Hey, Hunter, of course. I got you, bro. It says, Lexus, how many times should you be readmitted in nursing school before giving up? I don't even know. I'm trying. I want to answer that question, and I don't want to be an asshole for the fact that you asked me that. But you legitimately are asking because I feel like that's something that happened to you. So here's what I'll do for you, Lex. I'm going to read this again. How many times should you be readmitted in nursing school before you give up? If you really want to be a nurse, you never fucking give up. I don't give a fuck how many nursing schools you have to go to. If nursing is really something that you really want to be, then go make it happen. I know people right now that I actively coach that failed out of nursing school and then went back. Another one failed out of nursing school twice and then went back. It all depends on you. Natalie, what's up? How are you? Represent. Stay black. Mostly because my sweater's black and I'm melanated out here. You know what I'm saying? I'm right. You know what, Lex? I know that I'm right. Listen, I've been a teacher for 9 years. When I see messages come across or people directly talk to me, it's weird. Like I have like the teacher dad vision. I can see through it. So it's like when you ask me that question, I know it involves you. You know, so if it happens to you, that's okay. That is okay. You are on your own journey. Imagine that story. I failed out of three nursing schools and I still wanted to do it. And you made it happen. And then you worked as a nurse for 5 years and nobody ever knew that. Because you want to know why? Because it doesn't. Everything that happened before that doesn't fucking matter. It matters about what you accomplish and the fact that you accomplished becoming a nurse. That's what it means. Queen, how are you? Hi. I have joined a couple of your lives since my last semester of nursing school, and I'm happy to say, Natalie, that's what I'm talking about. Hey, y'all already know the deal. All 88 of y'all right now. First of all, smash that like button. Then I need for y'all to congratulate Natalie, and I want you to say it like that too. Natalie. Congratulations on passing your NCLEX. Welcome to the greatest, and I mean the world's greatest shit show of a profession known as being a nurse. If there's any piece of advice that you could give to everyone that is going on that journey, what would that advice be? And ma'am, once again, congratulations. I'm super proud of you. Natalie, I remember seeing you come in here a lot. So I'm glad that the NCLEX, that license is now yours. All right. Remember, ladies and gentlemen, once you get a license, you are the chief executive officer of said license. Listen, y'all see this piece of paper right here? Hey, and I don't give a shit if it's backwards, but look at that. This is one of my failures from NCLEX. Look at that. And I know it's backwards. Below failing, below failing, below failing, below failing, below failing. You're just like, Kevin, like what in the actual hell? Exactly, bro. Below failing. Now, if I would have kept this piece of paper and just read off of it, I would have like, fuck it, I'm not going to be a nurse. I got another one. I got two more over there. If I would have let these pieces of paper, they would have destroyed me if I would have let them take over. But I knew what I wanted. You're one step closer, right? That's all that means. You too good. You should be you too good. You should be teaching nurses. Queen, I am teaching nurses right now. Congratulations, Natalie. Shout out to you. Alyssa says, I've always been told that failure brings you a step closer to success and change your mind out. Absolutely. Let me tell you something right now. Nobody in this world ever did anything great ever without failing. Period. No one. And if anybody says, oh, I've always been successful at the things, they're a liar and fucking run from them. They're a scam. Run away from them. The last thing I would ever want to do is to want to learn how to become a millionaire from somebody who didn't fail. So Alyssa, whoever told you that, find that person and hold on to them. For real. Find that person and hold on to them. Thank you for your wise words of encouragement. Hey, y'all already know that's what I do. Y'all know that's what I do. I'm all about encouraging y'all. I'm all about pushing you guys to that next level. You know, doesn't matter if you buy my stuff or not. Do I want you to buy my stuff? Absolutely. But I'm here to guide. I'm everybody's mentor. Like this, I'm actually doing a redesign of this sweater. And on the back, it's going to say mentor. There's only going to be one that says mentor, and it's mine. And the rest of them are going to say nurse. Hey, be ready because they're coming. Be ready because they are coming. All right. It says I needed to hear that right now. That's what I'm talking about. Is it Panchi? Hopefully I'm saying that right. So look, I do these all the time. I do them all the time. You got to get off your beach. If you guys don't understand that reference, talk about D-Day, June 6, 1944, when the Allied forces stormed the beaches of Normandy, France, to go stop Hitler from doing Hitler things. When they invaded the beach, they died. And if you stayed there, two people were on the beach, the already dead and those that were going to die. So my question to all 76 of y'all, whether you're a nurse or not, what are you going to do? Are you going to stay on your beach and die, aka not progress, blame the world for everything that's going on and the problems that you have? Or are you going to run through the gunfire? Are you going to run? I'm knife handing every single one of y'all. Are you going to run through the gunfire? Are you going to run through the world throwing stuff at you? Are you going to run through relationships falling apart? Are you going to run through, difficulty at your job? Are you going to run through all the fear in your head to get off the beach and to conquer your beach? What are you going to do? You're going to swim? Oh, I wouldn't want to swim. Look, I'm not a good swimmer. The English Channel has really bad waves. I ain't trying to be back that way. I'm already on the beach. So the thing about it, like, I'm going to turn around and why would I do that? Run through everything. We run through it. You run through it. Hey, and guess what? You're going to be scared. You will be scared. I'd be a fool to tell you that you're not going to be scared. Doing something new for you in your life is a scary thing. It is very much a scary thing. But nobody ever got what they wanted in life by not pushing through that fear. Does that make sense? Appreciate you, Natalie, for the finger hearts. I appreciate you. So I always ask everybody what are you going to do? Are you going to stay on your beach? Or are you going to get off? Is it Abadonio? Thank you. Abadonio. Thank you for the rose. I appreciate you. Abadonio. Yeah, okay. I'm over here like Abadonio. Then take a stand and conquer. That's right. All right, cool. I'm glad I said it right. But shout out to all 75 of y'all. What other questions do you guys have? Remember, I'm all about the motivation. And you want to know what? It's like, since I failed my NCLEX 3 times, that was me, y'all. That was me. So, floating on the ocean, getting ready for this exam, getting ready to storm this beach. Storming this beach all the way through. And then as soon as the doors fall, it's reality. Just mowing me the fuck down. Everything that you could think of. Not just about the NCLEX, but my lack thereof of preparation and life that was happening right then and there. That's right. If anybody has ever seen the opening scene of Saving Private Ryan, I task you all right now at some point before the next live, which will be Friday, is to go and watch it. Yes, Samantha, you did miss the questions. It's okay. You're here all the time, Samantha, so I know you're good for it. So, but like I said, if you have never seen the opening scene of Saving Private Ryan, I recommend going and looking that up. And then you will understand what fear really looks like. But we use that as a metaphor. Imagine if they just stayed there. There would be nothing. That was the largest amphibious assault in military history to this day. Right. I was in the Navy, so this was something that was very, very much embedded into our very being, because we're on ships, we're with the Marines, and we get tasked to go with other services and stuff like that. But I really want y'all to think about that. I really do. Think about that. Do you want to get off this beach, or do you want to take that ass that way? Just saying. Shout out to all 87 of y'all. We did NCLEX questions Monday. We do them Monday, Wednesday, Friday at 5:30 Central Standard Time. That's the only time that matters. Love the inspiration. Hey, that's all I know how to do at this point, is to inspire and motivate. I was a leader in the Navy for quite some time, and that's all I like to do. I ain't chilling on the beach. We swimming. Ma'am, if you're swimming, you're going backwards, and we don't want you to go backwards. With sharks and all. No, you don't want to go that way. You don't want to go that way. Because you don't progress by going backwards. You have to run. You got to run through the fear. All right. Like I said, we do these questions every Monday, Wednesday, Friday at 5:30. So make sure you guys, if you haven't, make sure you guys are following, and you guys tap on that bell for the notifications. You know what I'm saying? That way you guys know when I go live. It says, wait, so what do? You run through the fear. You run through the gunfire. That's what you do. You run through the fear. Because nobody ever accomplished anything by turning around and swimming with the damn sharks. That's one place you don't want to be. It says, we all got this, everyone. The journey will be worth it in the end. 100% it'll be worth it. What's your time zone? Central Standard Time. Because that's the only time that matters. It says oh no, we're not going. Oh yeah, we're not doing that. We don't swim with the sharks. We fight through the fear. We push through the fear. And that is what the premise of my book is about. I promise you, that is the premise of what my book is about. It's about essentially telling you that you have to fight through the fear. You want to know why? It's because I went what everyone is going through right now. I went through the same exact thing. But it took, somebody, looking at me, we need to get off this beach. And it's just like, okay. And you know who that person was? It was a mentor. So as a mentor, I'm telling you to get the fuck up and go that way. Get up. Go that way. And by that way, I mean through the gunfire. It's like you're stuck between a rock and a hard place. Where are we going? I can't go backwards into the water. I can't go that way. And progression is that way. There's no other way. Progression is that way. I'm going towards progression, no matter how hard or how slow it may take me. But slow progression is still progression. Right? It's still progression. All right. Hey, but what other questions do you guys have? If you guys are new here, welcome. My name is Kevin. Been a nurse. Welcome to this side of Nurse Talk. Been a nurse for 3.5 years, worked ICU, OR, and PACU. Yeah, ICU, OR, and PACU. I had to think about that. I like PACU the most. Mostly it's because I had already had ICU experience, and I love the PACU. It was great. And most time you only had those patients for an hour and then you took them back up to their floor or they went to the discharge area. It was fab-tabulous. Fab-tabulous. Let's just see. It's like when a child's first step forward. Exactly. You don't see them try to back up. Even if they do back up, they do it as a way to pivot and then they push forward. You know, but naturally children do not walk backwards, and naturally neither should you. All right. But here's another quick little update. Coach Laban? Thank you for the rose, my good sir. Thank you. J4, thank you for the share as well. Couple of updates for the 7-day NCLEX course. How long does it take for me to do the NCLEX? I don't even know what that means. Like, how long does it take for you to do the NCLEX? Like, what? Study for it? Like, sit for the actual exam? You got to give me a little bit more context than that. But 7-day NCLEX course, I did a live lecture in there. Hey, when you guys are a part of that, you guys get to be a part of the community where I do live lectures in there. Also, I'm working on some more content that's going to be going up in there. Some motivational things as well as content that you need to know for the NCLEX, such as fundamentals, psych, some more pharmacology, psychosocial integrity, maternal health, as well as working on a cardiac section, mental health section, and I'm working on some pediatric sections as well. You know, safety for peds and all that good jazz. So there's a lot that's going to be coming here in the next couple of weeks to the following month. So make sure you guys are a part of that. How does one join the community? Is it IJ or LJ? If you check the link out in my bio, and then when it pops up like this, you tap it again and it'll take you to my page. Click the link tree. The link tree will say 7-day NCLEX. It's like join the 7-day NCLEX course for $7. You get a self-paced NCLEX course with a bunch of content videos that are in there, 65 videos actually. And then you also have access to the community as well. You can go to when you purchase, you can check your library. It'll be the community will be there, but they are interchangeable. So you can click and it'll take you to one and it'll take you to the other as well. So is it B Aaliyah? Invite. I don't know who that is. Let's see. Let me see what Bless G says. How long does it take to sit for the NCLEX exam? So how long does it take? All right, I don't know exactly what you're asking, so I'm just going to answer this. The NCLEX is a 5-hour long exam. So when you finally go and you sit or you write for your exam, that's how long, that's the duration that you have. If you're going to study for the NCLEX, that all just depends on you and how you retain information. I usually tell people 30 days. I usually tell people study for the NCLEX for 30 days. What's up, Samantha? Samantha just joined. Samantha May. That's like a really old name. Not saying you're old, Samantha. I'm just saying that's what I see. But what other questions do you guys have? I'm going to hang out for another few minutes. I'm going to get off here. What other question? Do you guys have any questions about getting into nursing school in general, graduation, NCLEX, your first year as a nurse, even things that you can do outside, after that. Hey, by the way, once you have your license as an LPN or as a RN, just because you have those licenses does not mean that you have to work bedside. It doesn't mean that. I live in Texas. Can't you tell? Right? So, but just because you have a license doesn't mean that you have to work bedside. Now, here's what I would recommend to you is go to a hospital and get the nursing skills. If you're trying to be a nurse practitioner, there's no way that you can even get into school without having patient care. CRNA school, you have to have ICU experience. So there's no ways around that. But a lot of jobs won't even take you as a brand new nurse unless you have at least 6 months to a year of experience, usually from a hospital. Now, I say usually, but there are a good amount of people that got their first job somewhere else, and it is all about who you know. So, but it's not impossible. It's not impossible. All right. D says grad. Grad what? What are we grad? What are we gradding? DD. What are we gradding? Hey, if you guys are just now joining, welcome. We did NCLEX questions. I know I keep repeating myself. I see a bunch of people jumping up in here, but We do NCLEX questions Monday, Wednesday, Friday at 5:30. Sorry, mistype. No, you good. You good. But yeah, what nursing questions do you guys have? Or just what questions in general? I mean, we don't even got to talk about nursing. We could talk about, whatever for the next 6 minutes. All right. Look, somebody asked me, do I like anime? I like anime. I like Demon Slayer. I went to go see them at the movie theater. Would not recommend. I would wait for you to stay at home. I mean, I'd recommend for you to watch it at home. Just saying. Just saying. Also, if you're one of those individuals getting ready to take the NCLEX, the day before you take your NCLEX, relax. I know that's better. That's better said than done. And I know people are just like, Kevin, who are you to tell me to relax? Listen, you can do whatever you want. These are all suggestions. These are not doctrine. But as somebody who has taken the exam multiple times, I would recommend that you don't do any type of studying at all. Because all you're going to do is continue to psych yourself out. You know the information. You know it. Is it possible to work full-time and go to nursing school? Yes. I was active duty in the United States Navy and worked a full-time job. Worked Monday through Friday from 5:30 in the morning till 5:30 in the afternoon, Monday through Friday, as an instructor. And I did all of my clinicals on the weekends. So yes, and I had a whole family, so it is very doable. It's very doable, very possible, Mila. But here's the thing: you go to nursing school, your life, nursing school, everything else. So you better figure it out. Remember, you got to figure it out. And nursing school does not care what you have going on. So if you're one of those individuals that are just like, oh, I'm a single mother, don't nobody care. Don't nobody care. I'm telling you right now, and I'm not trying to say, I'd rather you hear it from me than somebody at nursing school that is just like, we don't care that you have a baby. There are girls that were in school with me that had babies and they still were responsible for making sure that they took that test on time. I'm just saying. So be ready for that. Texas and Canada have the same nursing system. I'm new here in Canada, British Columbia, and I need guidance. Hey, if you need guidance, I'm glad that you're here. Make sure you follow, of course. And if you need something more than that, the NCLEX coaching and mentoring is not just about coaching and mentoring for the NCLEX. I also will mentor you as a brand new grad. That's what I'm saying. Is like you get more than just a coaching for the NCLEX. Deborah says, for you, do you prefer doing classes online or in person? Debbie. I don't even know why I said all those. I'm sorry. But for nursing school, I wish I would have did it online. I wish I would have did it in person because my nursing school was all online. But then again, it really wasn't all that hard for me because I had already had a lot of medical experience. So me being an online student wasn't too bad. My prerequisites were all online, which were cool. But me personally, I would have rather been in person in nursing school. It says, thank you. I currently work at a hospital as a pharmacy tech and want to change careers. Then Mila, do it. Do it, boo. Do it. Can you hold a session on EKG interpretation one of these days? So if I do a lecture on EKG interpretation, I'm going to do it inside of my course. But I don't see why that wouldn't. I could do those in the future, but most of the time, the lectures, those get done inside of the course. It's the questions that I usually do on TikTok. So it's not, it's not off the table, but the majority of the time that I do things, they are question related. So, but no, I don't know. We'll see. IJ or LJ, both. All right. I got about another 2 minutes, y'all. What are we thinking? As an ICU nurse, right? Right. I was about to say as an ICU nurse right now. As an ICU nurse, RN, if you have a patient, DNR, DNI, who has cardiac arrest, what are you going to do at that right moment? I am not going to do anything. They have a DNR, and so I will not follow it. I actually had that happen. I didn't personally have this happen, but there was a patient that was next to me when I was working in the ICU, and the nurse didn't read the chart, and the patient coded. And they started, doing CPR. They called a code blue, and then next thing you know, another nurse comes around the corner, and she's just like, y'all, hey, stop. He has a DNR, and I'm over there like, 'cause I'm in my room, and I'm like, because the family member was in there and saw that, and people don't realize that when you see a code blue happen, it is traumatic. Like the person that's having it done is traumatic, but the person, family member that's seeing it, it's crazy. All right. It's crazy to them. Did you hear about Mississippi trying to close 3 HBCUs? I did not. I did not hear about that. Before notify the doctor. No, if there's already a DNR in place, that means a physician has already seen it. There's no need for me to call the doctor. Now, if there's a DNR in place, and then you have a family member that is just like, you need to save them, that call is not going to be on you. That call is going to be whoever that attending physician is. And that's when documentation goes a long, long, long way, because do not be surprised if somebody audits that chart and then you're going to court and being like, did this patient have a DNR? Be like, yeah, they did. And then be like, did you sign this? Yep. Did the doctor sign it? Yep. Did a witness sign it? Yep. So why did they perform? Well, and then they're going to go and look at your note. According to the doctor, blah, 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 blah. And then that's you covering your ass. Because guess what? The Board of Nursing cares about protecting the public. If you fuck up, they will rip that license away from you. They don't give a shit about what your policy says at a hospital. Oh, my hospital told, nope. And then the Board of Nursing will be like, what I say. That's just like you saying like your parents saying that you can go over to your friend's house, don't act up, don't embarrass me. But you go over to your friend's house and you start, cursing up a storm. Right. And then your parents find out. And then they were like, oh, well, they let me curse. They'd be like, yeah, but do I let you curse? Then we'll make you think you're going to go over there and do it. See what I'm saying? I just made that up on the fly, by the way. I'm just saying. Just be ready for that. But anyways, yeah, that's exactly what I would do. And I've seen it happen before. And I'm like, oh, well, there you go. So, all right, ladies and gentlemen, I'm going to call it a night. I appreciate everybody jumping in. Hey, these are no shameless plugs. I am very not shameless about what I'm doing and creating. All right. So make sure you guys check out everything I have going on in my bio and my link tree. Get that free download. Check out the 7-day NCLEX course. Hey, you can join it for $7. That's like less than whatever venti ass drink you get at Starbucks. Stop playing games with me. All right. Also check out the victory guide, 700 pages, y'all, of deliciousness. Also, if you're one of those individuals that need help one-on-one privately, come holler at me. Check me out at thebootnurse.com/coaching. You can also follow me on YouTube, because all of my lives will eventually be up on YouTube. They will eventually be up there. So make sure you guys go over there and check that out. Enjoy your spaghetti. Hey, it's finna be delicious. All right. And the last thing I'm going to tell you guys is to take care of yourself. Be kind to yourself. You only got one you. You only got one you. Once again, Grace lurking until the end. I can't stand you. IJ, yeah, definitely go check that out for sure. But make sure you take care of yourself, because you only got one you. All right. But I appreciate everybody being here, rocking with me. I appreciate you guys being here on this Wednesday, and I hope that I can see everybody on Friday. But until then, ladies and gentlemen, y'all keep studying, y'all keep doing your thing, and I hope to see y'all on for Friday.